All right, hey everybody, I'm Rob Hughes, an anchor here at Atlanta News First, and I am interviewing really just an expert in a few different fields today. A pretty exciting interview for parents out there. We know many of our viewers are parents. I'm a parent myself, looking forward to learning a little bit more about parenting and really just be a little more intentional about that entire process, which we know is a huge part of our lives as parents. So I want to introduce, let me make sure I got this right, Dr. Pete Loper, again, triple board certified physician in pediatrics, psychiatry, and child psychiatry specifically. Doctor, thanks for joining us.
Thank you so much for having me.
Give me a little idea of your background. Of course, I kind of gave your credentials there, but how'd you get into what you do and how long you've been doing it and where are you based out of?
Yeah, sure. So put simply, I love kids. I too am a father. I've got four of my own, and so my wife and I, and so that definitely was really important to me. So when I went to medical school, one of the big steps that you got to take is, do you want to care for adults or kids? I chose the kid route, did a pediatrics residency, and then did a residency in adult psychiatry, and then specialized in child psychiatry. And I'm currently in Columbia, South Carolina at University of South Carolina
Okay.
School of Medicine.
Yeah, so you're qualified by education, but also real world experience, huh?
Absolutely.
That's got to be an interesting deal. I mean, to be so, I guess, knowledgeable about that process in terms of helping a lot of other people, parents, children, but also putting, I guess, a lot of what you practice what you preach type of thing, right?
Boy, yeah, I'll tell you, and it's harder than it probably sounds. And my wife has to remind me all the time that I'm not a doctor when I walk into the home. So that's very important.
I bet that's easier to accomplish some days than others. I guess just give us a little bit of an idea. I mean, parenting, it shifts, especially when we tend to think of it ourselves. I'm a younger parent. Certainly the last time I thought about parenting was when I was a kid and when my parents were bringing me up. So that's the context a lot of us have with parenting, right? You don't think about it until you become a parent yourself. And the last time that you have really any intimate knowledge, albeit on the other side of the coin, I guess, is when you were a kid and you were having to deal with your parents. So how much of a shift can happen within a generation in terms of parenting style?
Yeah, so becoming a parent is definitely life-changing. What I would say though is that really any kind of effective parenting it's parent to parent is really a verb. Obviously, we can minimize ourselves in scope and complexity to the title of mom or dad, but to be a parent is to be actively involved and engaged. It's a dynamic, kinetic process that involves time and attention and lots of empathy and patience.
Yeah, I mean, it's such a complex relationship. I mean, it's so simple, but also so complex, and really, it's just hard to describe for those that aren't parents yet. At least what it's like, to be one. Can you give us a little bit of insight about the differences in parenting across generations and why we see shifts and changes?
Sure. So first and foremost, in general, there's four accepted parenting styles. There's authoritarian, which is a little bit more task-oriented. It's a little bit more demonstrative. Authoritative, which is kind of the one that we should all strive to achieve. It's more empathy-based, but still setting those firm limits. There's permissive parenting, and there's also neglectful parenting, both of which can have consequences as well. In terms of the parenting between generations, listen, the bottom line is that, again, you spell love Time and Attention. Human beings develop in the medium of love. And right now, as we all experience, whether we're parents or not, time is a scarce resource. The world has become exponentially more complex, and our attention is being diverted in multiple different directions throughout the course of a day, whether we're parents or not. Compound being a parent in that dynamic in our current sociocultural construct where time is so limited and the world is so complex, it becomes harder and harder to be effective. And I think that is a big issue that we're struggling with oftentimes in our culture and society.
My wife and I have this discussion every day where we kind of break down each little interaction, and especially when we're not proud of how the interaction with our kids went, more so than remembering all of the good that happened in a given day. We tend to focus on the one time we got frustrated or we didn't handle things how we would have liked to. I feel like the wealth of information also comes a degree of anxiety for parents to make sure that they're handling things perfectly, but that's also not reality. So what would you say to the parents who are, out there really dissecting, how good of a parent they are on a day in, day out basis based on these just one of dozens of interactions on a given day?
Yeah, stop it. Just kidding. I know that's easier said than done, right? As parents, that anxiety is just a direct reflection of the love and caring that you have for your child. But the reality is that if you're invested and you're willing to spend that time and give your child attention, it's okay to make mistakes, and mistakes are going to happen. Human beings are in a perpetual state of development from the time we're born to the time we die. We're constantly developing. As parents, if we're new parents, it's a new experience for us. We're not going to be that great at it right off the bat. We're going to have to fall on our face and experience some adversity and some challenges. The key is, though, to continue to devote that time and intention in being present with your child and give yourself permission to not be perfect. It's totally okay. There's no expectation to be perfect.
You said it. Easier said than done. I mean, I have, again, I don't know if I said specifically, but I have a 3.5-year-old and a 2-year-old, and they are, just such in these developmental stages about how their emotions work. And our 3.5-year-old's really good at articulating some of those complex emotions, which is great. I'd like to think we had some role in that, but it doesn't necessarily mean that we don't have meltdowns on an almost hourly basis. So the patience is constantly being tested. How normal is that, I suppose? I tend to think it is normal, certainly, but it's just, it feels like, we're on the cusp of an emotional meltdown at any point during the day with 2 toddlers.
Yes, that is very developmentally normative. That moment in time that both of your children are kind of anchored in right now is this moment where they're developing their sense of will. And developing this sense of will means that not only do you recognize that you have your own will, but you're having to learn the limits that you can't impose your will at any given time. So the word no is really, really powerful for them right now, and that's totally developmentally normative. But what I would also say too is that if you think about parenting as being kind of the crucial rate limiting foundation to the fact that human beings are inherently social creatures, in order for us to develop throughout the course of our lifespan, we have to be able to relate to other people in meaningful ways. The template by which we relate to other people is really set during those early developmental stages by the way in which our parents parent us and engage with us. So being able to allow them to access those feelings of emotion, those strong feelings of emotion, and throw those temper tantrums and accept them for where they are in that emotional state and teach them that it's okay to feel frustration and anger. That's really, really important.
Right. And yeah. When we experience that, I mean, like I said, we're pretty proud of how we handle things, like the super majority of the time. But you can't help but wonder, it seems like anything that happens that you're not proud of, they seem to catch onto and hold on to more than the 90% or the 99% of the time that are such positive interactions and you are proud of it. I mean, is that fair to say that they seem to key in on those things that maybe parents wouldn't be as proud of?
Yeah, absolutely. And it's a really great point. The reality is that the majority, especially at that age, the majority of communication is going to be nonverbal. And it's the way it is as human beings. A significant percentage of our communication, even as adults, is nonverbal. They pick up on those nonverbal cues and they pick up on your emotional tone and tenor. One of the things that really scares me and concerns me as a pediatrician, a psychiatrist, child and adolescent psychiatrist, and also as a parent is within our current sociocultural construct, we tend to really minimize the value and import of emotions, and we value judge emotions. And we indoctrinate our children oftentimes in this concept that being frustrated or sad is consistent with pathology, or anxiety is consistent with pathology, when in reality, these emotions are fundamental to the human experience. They add a richness and depth to the human experience. If we don't have episodes where we feel down or sad or anxious, how can we fully appreciate and enjoy joy and happiness?
Right.
And so at this moment in time, you're engaging with your kids. It's tough. You're going to have your emotional tone and tenor. Teach your children how to engage with those emotions and process those emotions, verbalize those emotions, acknowledge those emotions in a meaningful way. It goes a long way.
And we battle that. My wife and I, just with each other, we're talking, we want to acknowledge our own emotions, because how could we possibly expect our kids to acknowledge theirs, both good and bad, if we don't? And so I've certainly noticed that, sometimes you succeed at that, sometimes you fail, but I certainly, I don't always say, when I'm frustrated, when I should just probably communicate that so that we can get to the bottom of it and move on. Sometimes if I can't do that, how in the world could I expect a 3-year-old to do that? So it's kind of a daily battle and kind of redirecting maybe some of the things that were ingrained within me from an early age. And kind of on that topic, reporting in the news today, so a few troubling things. We had one where there's been multiple really violent school fights at one of our local high schools. And we're talking about 14-year-olds and 15-year-olds. And every time I see something like that, I can't help but think, well, what happened in their development at a younger age that brought them to this point as 14 and 15-year-olds to make them think that it was okay to solve their problems in this way or not be able to effectively communicate the things that they're going through. I mean, how impactful is parenting from that early age so that we can avoid, things like that? And another one too, the shooting, you're in South Carolina, but in North Carolina, in Raleigh, we're talking about the suspected gunman, 15 years old.
Yeah, you're absolutely right. The template by which we relate to other people are emotional intelligence, those 5 core components of emotional intelligence as described most popularly by Dan Goleman: social skills, motivation, empathy, compassion, self-awareness, self-regulation. We develop that skill set from interactions with our parents during those fundamental psychosocial stages in our development. The other thing I would say too, though, is that human beings are not immune to the second law of thermodynamics, which states explicitly that any system in isolation will experience entropy. It'll become chaotic and disordered. And if you look at it, human beings are highly complex ecosystems. We're a system in and of ourselves. And we were in the isolation epidemic even prior to the COVID pandemic. We were the most isolated society in the history of civilization. Now throw in the COVID pandemic, and we're even more isolated. And not only are we physically isolated from each other, right, during the course of the lockdowns, the quarantines, which in majority of places have resolved, but then we also isolate ourselves oftentimes in our electronic devices. We can be sitting directly next to our loved ones, and we're off exploring in a world apart in this separate universe on our cell phones and not engaging or interacting.
A lot of what we've been talking about so far is just developing that emotional connection with your kids from an early age, and knowing that they're loved and that they're cared for, and give them a sense of security from a very young age, and then allow that to develop over the course of years into the young adulthood for them. There may be some parents out there who are watching this and think, oh, that's, of course, of course I want to develop an emotional connection. I love my kids. I tell them I love them every day. But there probably are some parents out there too who wonder, how can I develop that emotional connection with my kids? Or maybe it's gotten lost over months and years or through different stages of a kid's life. How can you what message can you send to those parents to try to redevelop that or strengthen what's already there in terms of emotional connection with our kids?
Absolutely. That's such a great question. And so we often tend to parent how we were parented. And if in the home that we grew up in, you weren't allowed to exhibit or demonstrate quote unquote negative emotions, again, no such thing as negative feelings. All feelings have purpose. But if you were raised in that construct, then very oftentimes you may struggle to support your children in engaging with those feelings in a meaningful way. And you yourself as a parent may struggle. So one of the best things that you can do is get a coach. Get somebody who can support you in developing those emotional intelligence domains that are going to allow you to develop your self-awareness and self-regulation to engage and process those feelings in a meaningful way. If that's not sufficient, and if you have a history of trauma, neglect, or abuse as a parent yourself that was anchored in your childhood, go and get therapy. Therapy can go a long way for bolstering your capacity to engage with your negative, quote unquote, negative feeling, your feelings, right? And thereby help support your children in engaging in an effective way with theirs.
You bring up an interesting point too, because the word therapy for some people is immediately associated with negative feelings. You're like, oh, I don't need help. Like things are going fine. What would you say to those, who feel that way, and or maybe, it's just, yeah, that sounds great. I know that, a lot of people go get coaching or therapy for a variety of different reasons, even if things aren't just in a downward spiral. But they don't prioritize it, or maybe I don't have time for it, or because their parents and kids, lives are busy, right?
Yeah, it's a great point, and there certainly is a lot of stigma associated with the word therapy. But what I would say is, for 99.99% of our existence as a species on Earth, until a millisecond ago in our existence, we live family of origin embedded in these communities, tight-knit communities of no more than 100 and 120 people. therapy would occur on a day in and day out basis as we engage with the distress that was inherent in the human experience, in the loss that we'd experience day in and day out of family members and people we loved. Therapy is inherently organic. It's very structured in the context of our current life experience and our current culture and society. But nonetheless, there's something very, very important about it, because mental illness is not simply a chemical imbalance in the brain. That is a gross oversimplification and a misconceptualization of what mental illness is. Mental illness is a lack of capacity to process the negative, quote unquote, life experiences that you've had, and a lack of capacity to engage with those, quote unquote, negative emotions in a meaningful way, to adapt and to develop and to overcome those and process those. So therapy is a beautiful frame to process. It's organic and it's inherently human. And that's really what I would say to anybody who's resistant to it.
Isn't it kind of ironic that you mentioned that, for thousands, if not millions of years, people were in these small communities of 100 people or whatever, and they got therapy that way, even without licensed clinicians and things of that nature. That with a couple 100 million people in this country, that a person could go about their day-to-day life through a city the size of Metro Atlanta, go to work with hundreds of people, and then feel super alone, even if they have their own family, wife, kids.
Yeah, that is absolutely spot on. And again, if you think about it, it was 12 to 15,000 years ago was the agricultural revolution, where humanity developed the capacity to farm at scale almost simultaneously. And at that moment in time, we removed ourselves from that core community construct that we had lived in, intimately integrated into our physical environments, and we started to build civilization. And so from that moment in time, the core construct of community that makes us human and allows us to engage with our negative experiences, allows us to process our negative thoughts, and the feelings that are associated with those thoughts has degraded slowly and slowly ever more, to the point where here we are now. And I think that all of us are oftentimes inherently resistant to acknowledging the fact that we're going to have negative thoughts, we're going to have bad things that happen to us, we're going to have negative feelings and what would be deemed, quote unquote, negative feelings and emotions. Those negative feelings are really, really important to engage with and access and process. And if we don't do that, then we are going to feel isolated, alone, and we're going to get worse.
I want to go back to your parenting styles real quick, because you said that there's 4 of them, and that you would like to be one in a perfect world. And I'm looking at them and I'm thinking, you know what? I fall in that category. I don't know how much I fall in that category, though. It might be 90% of the time, might be 20% of the time. So, what style, again, would you reiterate that you would aspire to be? And then, is it fair to say that, although you may aspire to be, or maybe you do mostly fall in that category, that at times you will shift in and out of these different styles of parenting?
Absolutely. Yep, that's exactly right. So the 4 parenting styles are just a basic scaffolding or framework for parents to look at and utilize. The one that we really emphasize or we really reinforce as being the superior parenting style is the authoritative parenting style, which you're setting firm limits, but you're also giving the child choice and autonomy. And so that's really, really important. But once again, time being the rate limiting step, for me at least, oftentimes I will regress to more of an authoritarian parenting style, where I'll be very, very abrupt and direct with my kids. Get your shoes on, right? In situations where time is limited. Or oftentimes if I'm really, really busy with work, I'm not able to get through my day, I'm carrying my work home and I'm sitting, at my computer at home trying to engage in my process, I become a neglectful parent. Or again, back to this idea of supporting our kids and navigating those negative, quote unquote, negative emotions, those temper tantrums. Oftentimes we regress to being permissive parents and just giving in and giving the child whatever they want, just so we don't have to deal with their affect and their emotions. So really it's this idea, it's really the goal is to be an authoritative parent, recognize that, you're not always going to achieve that, but that's kind of the gold standard for everyone to seek to achieve.
I can relate to the shifting out of authoritative to authoritarian with the put your shoes on. Hey, stop doing that. Hey, stop hitting your brother. My my little one is starting to learn to not just take the teasing or the whatever from his older sister. So he's starting to hit back and all those things. And I'm sure any parent who's had kids can. I see you nodding your head like, oh yeah, no, I know exactly that stage. There's so many things we experience together as parents, but I was curious, in your work, what do you see a lot of that come to you for help? I mean, what are some of the common issues and pitfalls in parenting?
So there's 3 fundamental ingredients required for healthy human development. The kids that come to see me are exhibiting maldevelopment. They're exhibiting avoidance, withdrawal, and acting out behaviors in the absence of those 3 fundamental ingredients that are necessary to support healthy human development. which is approach and exploratory behavior. It's engaging in life. And so the three fundamental ingredients are challenge. You got to be taken out of your comfort zone on a consistent level. Most kids are engaging with challenge on a regular basis. The second ingredient is adversity and sometimes overt failure. Failure is crucial, rate limiting step to human development. But the most important ingredient, by definition of our humanity and the fact that we're inherently social creatures, is our relationships, our capacity to relate to others. So what I see an epidemic of is avoidance, withdrawal, acting out behavior that then result in these downstream symptom indicators that co-clustered that we define as major depressive disorder or generalized anxiety disorder or PTSD. But the upstream phenomenon is a compromise of those meaningful relationships, typically in the family of origin, right? Due to trauma, neglect, abuse, ACEs, adverse childhood experiences, where those relationships and the parents that were supposed to be parenting these children in a loving and meaningful way, due to whatever reason, were unable to or violated that construct of parenting. And that's what I see every single day on the inpatient unit that I work on.
You know, when you use those words, trauma, neglect, abuse, those are really strong words, and people think, you know, the most horrible of situations. But those words kind of, from what I gather, extend themselves to things that are not as overt. Is that fair to say? Even absenteeism and things of that nature. So, you know, neglect, abuse. I mean, I'm thinking, you know, a parent hitting their child or whatever. But those words they have a wide definition.
Yeah, there is a spectrum, right? A very, very broad spectrum. And so the bulk of the patients that I'm seeing have pretty severe, robust trauma or neglect or abuse. And that's why they develop the more severe pathology. I work on an inpatient psychiatric unit, acute crisis stabilization unit for kids in crisis. And so that's the bulk of the patient population that we see. But to your point, neglect can be as simple as a consistent pattern of a parent engaging with their cell phone or with a screen instead of engaging with their child, which we see very, very often. And that accumulative consistency in engaging with the screen and diverting time and attention to a screen versus your child cumulatively can have an effect. It can compromise that necessity of that meaningful interpersonal interaction, that relationship that supports healthy human development.
How does that show itself, and what can be the negative long-term impacts of that? Because, you know, what you see is just somebody with their nose buried in their phone, but really what does that mean? Does it make them more likely to experience depression the older they get? I mean, what are we talking about?
So avoidance, withdrawal, and acting out. And some of the things that we tend to look for when it starts to become more severe would be school avoidance behaviors, not engaging in schoolwork, a decline in school performance would be another thing that we'd start to look for. That's actually a really, really big red flag. The biggest red flag, especially for our school age and really more specifically for our adolescent age patients or kids, is going to be social isolation. And so if you start to see consistent avoidance, withdrawal, or acting out behavior that ultimately manifests as avoiding going to school, avoiding doing your homework, not wanting to engage in your extracurriculars, your sports, losing interest in your sports, or overt social withdrawal, where you're just not wanting to be around anybody and you think everybody is thinking very negatively of you. Those are some big red flags that there's a compromise in that fundamental human need of meaningful relationships that are required to support healthy human development.
There's a wide variety of issues that parents face on a day in, day out basis. So I want to leave this just kind of opening it in general to you, is really just my last question. If you could leave parents who are watching, and if you're a parent watching, you're probably pretty invested in being a parent, I would think at this point. So what advice or what pick-me-up can you give to parents who are in that daily grind, no matter how old their kids are? Just something that you can leave them with as they go home and see their kids today and think, hey, this is something that I need to be thinking about more often.
Yeah, it's such a powerful question because money matters. The cost of living is going up. Inflation is real, right? And so there is this sense of responsibility as a parent to be a provider and to make sure that you're making sufficient income. But never, ever, ever should it come at the expense of time and attention to your child. There is no amount of money that you can place on time and attention with your child. So the best advice I can give any parent is make it a priority and be intentional about setting aside. It doesn't have to be a ton of time, right? 20, 30 minutes a day for the little ones, even 15 minutes for your adolescents, that is their devoted time, that you just look at them and you engage with them in a meaningful way. Time and attention, love, human beings developing the meaning of love. Make sure that's number one priority. Prioritize the non-financials over financials with consistency.
It seems so simple, and I think a lot of parents watching do that, and I think that we probably go times where we don't do that, or we think we're doing it and we're actually not. But that's a great reminder, certainly, to just spend that meaningful time, just the two of you. And if you have multiple kids, you try to spend that one-on-one time with each of them, certainly, because ours are just together so often as a 2-year-old and a 3.5-year-old that they spend every waking moment together. And I'm sure that they, understandably, I would get tired of anyone that I spend, who knows, 12, 14, 16 hours a day with. So, Doctor, thanks so much for joining us. This was really informational. We appreciate your expertise, and yeah, really, really informational.
Thank you so much for having me.
Hey, you have a great day.
You too.